find such a love at our age. Whoever thought we could dance on a thrilling... Welcome to Couples Therapy in 7 Words. I'm your co-host, Judy Alexander, and I'm here with my husband, Dr. Bruce Chalmer.
Hello, Judy. Hello, viewers and listeners. Judy, what's the title for today?
Can psychedelic therapy benefit couples? An interview with Dr. Stephen Radowitz.
So, we just had quite an interesting interview with Dr. Radowitz, and it was, in my humble opinion, fascinating, and learned a lot about psychedelics and how psychedelics are helpful in treatment of a lot of different things, and including how it benefits couples,
right?
Which, of course, is our particular interest.
And I think he's the first one that we've had on this topic.
Yeah.
So
I don't think we've had anybody else before on this particular thing. So check that out. Before you do that, let's crow about some of our books.
Okay, let's
What should we crow about first?
Well, how about we crow about, we'll do it in reverse order. Yeah. We usually save the Blue Tent for last, but we have the Blue Tent, Erotic Tales from the Bible by Laria Zilber.
Laria Zilber, who is, I have to tell you, my secret crush.
Yes.
Yes. Because folks who have followed us know, actually, Laria Zilber is a pseudonym for one lovely Judy Alexander. So
if you're looking to spice up your couple's life, I suggest you get a copy of that book, and you can either listen to it or read it to each other.
Yes, indeed. And it is beautiful erotica. You know, there's erotica and then there's erotica, and this is really beautiful erotica and deeply spiritual. It is based on biblical characters, and it is biblical characters with whom
not just biblical characters, but the stories from the Bible itself.
The stories from the Bible itself,
right.
And exactly, and you have a deep love and understanding of those characters, and it emerges, it comes through, and so absolutely. Now, whether people should perhaps read this when they're using psychedelics, I don't know. Why not? But that's
why not?
That's not what we're talking about in the interview.
No, I don't think Dr. Radowitz uses my book.
I don't think they use. No. He mentions in the interview they use music. They don't use erotica, but you never know. Anyway, just a thought. Maybe we should have suggested it.
Okay. So,
Other books.
We have your latest book, Betrayal and Forgiveness, How to Navigate the Turmoil and Learn to Trust Again.
Yep, which is actually selling pretty well.
It is.
I want to put in a special plug for viewers and listeners of this podcast, not only to, of course, to get the book, but I really want even more people to put reviews on Amazon, because that's how more and more people find out about stuff. That's kind of part of the deal. I've got a couple other books that you can check out. I guess you'll hold them up while we're at it.
We'll mention them.
Yes.
It's Not About Communication, Why Everything You Know About Couples Therapy Is Wrong, and Reigniting the Spark, Why Stable Relationships Lose Intimacy and How to Get It Back.
Yep, and you can check those out, all available in your favorite formats. I've been interviewed on several other podcasts recently. I just want to put in a plug for 2 things. One is my website. You can go to ctn7.com, which is our podcast website. BruceChalmer.com also has information about my practice and, of course, links to my books and stuff. And I also want to put in a plug for my newsletter, which comes out monthly or so, roughly, when I feel so moved, and I'm thinking of that especially because I'm going to be putting in some links to some of those other interviews, which I think were a lot of fun.
Right.
How can people sign up for my newsletter? How might they do that?
How might they do that? I would say they should go to ctn7.com. That's CT in the numeral 7.com.
And when they do that, they will see there is a box that is available to sign up for Dr. Chalmers' newsletter. Same thing happens if you go to brucechalmer.com, by the way. You can sign up for my newsletter. When you do that, you will get a free PDF of my booklet, 7 Words to Jumpstart Your Love Life. Fun booklet. It's not erotica, but it's spicy, but it's not erotica. But 7 Words to Jumpstart Your Love Life. You get that for free when you sign up for my newsletter. Let's get on with the interview.
Okay.
And we'll see you on the other side.
Our guest today is Dr. Stephen Radowitz. Dr. Radowitz is the Chief Medical Officer of New Shama, a treatment center that offers ketamine and other psychedelic therapies for mood and eating disorders and alcohol use disorders. Dr. Radowitz has practiced internal medicine and primary care since 1998. Originally from Montreal, he completed his MD at Chicago Medical School. He worked at St. Vincent's in general medicine and HIV/AIDS units and was medical director of the inpatient alcohol and opiate detox and treatment unit. Dr. Radowitz's focus is preventive medicine. He believes psychedelics are a powerful tool to discover the origin of imbalance. On a spiritual journey with Kabbalah, he also studies meditation and yoga. At Nushama, he leads one of the most experienced teams in psychedelic medicine. Stephen, welcome to Couples Therapy in 7 Words.
Thank you for having me. Thank you for having me.
Well, delighted to have you. So, we always like to ask our guests initially, how did you get into the work you do? Tell us something about your own journey.
Yeah, I mean, I guess my real psychedelic experience was studying Kabbalah. A patient of mine who wasn't even Jewish gave me a book on Jewish mysticism. It was a simple book. And I read this book and it just changed. I didn't grow up religious, but it really changed the way I see the world from a very different perspective. To me, that's a psychedelic. Psychedelic is soul manifesting. I start to see things through a much more open lens. And that changed the way I practice medicine a bit. I started to see it, try and practice from a more holistic point of view, not just from medicinal. And over the years, through that change, I got introduced to psychedelics. It was really through some of my patients who had experienced and had actually medical benefits from psychedelic experiences, to my own partner who was suffering from severe headaches after her first child was born, and eventually tried everything from acupuncture, sinus surgery, medications, and nothing really worked on these daily headaches. And we're introduced to a very like a psychedelic wellness center, I guess, and where he took part in a ceremony, and the headaches completely went away. He was shown where the headaches were coming from, and it was amazing. We're both physicians, and we didn't really do these things before. It was the first time we used substances like that in this setting, and so we started experimenting more. Really going into it in a very controlled way. And I saw the power of this. And when COVID hit, someone we'd met in that world came to me and said, "Hey, I'm thinking of opening up a psychedelic wellness center using ketamine." I'm like, "Okay, that sounds interesting. I think we're going to need it." And and I started part-time. I was still in my private practice, and it was much more effective than I expected it to be. And I've been doing this full time for well over about close to 3 years. So
Wow. Yeah.
What was it in Kabbalah that you said changed your view?
Yeah, I think our perspective in life, the whole idea of the way we see our own life and the way we live our life in this world, change. And seeing everybody as an offshoot of ourselves. It's very Buddhist, ideas also. They're all the same. I mean, I've read.
We're all in this together.
We're all in this together.
Yeah.
Everyone's just having a different perspective. Like I remember walking out of my Kabbalah class, and I was like, I saw the homeless person in the street, and we learned in the Kabbalah class that person's just you having a different experience, and seeing that there's a reason. Sometimes these people who beg on the street are just there to give you the opportunity to share, to give you the opportunity to whatever, to change the judgment. There's nothing in this world that's not, it's almost like a movie, and we're here to learn from it. And the universe, God, or whatever you want to, will put things into our movie set for us to learn things. And so when you start to see things like that, there's no mistakes. There's no good luck, bad luck, no luck at all. It's all opportunities to become better and become more, godlike in a way. And that really changed my perspective. And in relationships.
I'm reminded of something I heard from someone I think it was a 12-step expression. I hadn't heard it before. The acronym AFGO stands for another fucking growth opportunity.
Exactly. That's exactly what it's about. It's very simple, actually. I think the whole thing is quite simple. I think I always thought one day we're going to, on the other side, when we're done here, we're going to go, oh my God, that's all I had to do. That's it. Shit. I was like, that's what I need. I think it's going to be very simple. This whole thing will be very simple, but it's a process and it's a game, and it's here for us to enjoy in a way.
Yeah. So This is a very general question, but how do you use psychedelics in helping your patients? Like what would it maybe take us through some? And of course, our particular interest in this podcast is couples, and I'm really especially curious about like how do you help couples with this?
Right. So I think, most of the people coming to us, most of the issues in couples often are our own issues, so,
Hmm.
and the issues we have with ourselves, we'll see in I think the couple, the person we choose to spend our time with or our life with or get married to, sometimes will be triggering. It's initially it's all the love and everything's great. And then we get challenged. And often the things that bother us in our other half are the things we need to fix ourselves. And I think that's where psychedelics come in, is it allows us to work on ourselves, work at really seeing our life, our issues more holistically. And when we work on ourselves, that benefits the couple.
Hmm.
And I think doing couples work, it's good when both are doing it. Like me and my partner, husband, we both went through these experiences together, and it was incredibly helpful. And
Mm.
through our psychedelic, and most of it was group work, the psychedelics I've done. And often people would come with their loved ones. And I saw incredible changes. I mean, everybody I know who did it as a couple, it had incredible benefit. Most, I shouldn't say everybody, but most.
Hmm.
I mean, some couples maybe aren't meant to be together anymore. There's that point also where we have to move on. But often I think it's worth working things out. And this allows working with psychedelics really allows us to take a very different approach and a more open approach to working on ourselves and then working on the couple through that lens.
So
So
how does it work?
so how it works is, so the way we work right now, in our center, we treat people with generally treatment-resistant mood disorders. Okay, so
Hmm.
people with depression, anxiety, PTSD, and I mean, in the end, most of the people come in here have some type of difficult life experience, or people call it trauma, that happen often when they were children, and that affects the way we see the world, the way we see ourselves, the way we see our partners. And so what we do is we put them through a program. It's a specific protocol, a series of 2 infusions a week, ketamine infusions, IV infusions, a week over a 3-week period. And that protocol is based on the best science we have out there. There's a lot of studies from Yale, from Johns Hopkins, from a lot of other centers that have been working on this. And we've seen well over 2,500 people come through our program, 10,000 or over 10,000 of these infusions. And that protocol works really well. It takes a little while. We escalate the dose. So when people come in here first, they first have to go through a medical and psychiatric intake. So we make sure that it's a safe option for them medically. There's no contraindications, medical or psychiatric contraindications or things that would prevent them from going through this treatment. Make sure it's a good option for them, so they have an indication for it. It's going to help them. And
Hmm.
then once they're cleared, then they go into the program. And then, it's very, it's clinical. We have a nurse and medical assistants who go in, check their vitals, and make sure everyone's stable at the time of the treatment. Then they meet with an integration with the practitioner, myself, or we have a psychiatric nurse practitioner who will discuss dose. We always get permission to dose. So, and each
Hmm.
time we start at a certain dose, and we escalate as tolerated and how well they're doing. Each time they come in, we'll discuss the dose with them. And then once the dose is set, they'll go, it'll be put into the bag. They meet with an integration coach who could be a therapist. Most our integration coaches are licensed therapists who will talk. It's not about therapy, but just creating a safe space, talk about their intentions, what do they want to work on, which is discussed a little bit in the intake as well, the medical intake, and then do a little bit of breath work, meditation, ease them in. They're given an eye mask, earphones. We have about 12 different playlists, curated playlists. And the music is a huge part. It's the main part of it.
Hmm.
So under the influence, and then we put up the drip and they go into a 60-minute infusion. And the music during the experience really drives the whole experience. It's called synesthesia, where they actually see the music.
Mm.
As you escalate the dose, it becomes a little bit more what we call psychedelic, more colorful, more otherworldly. And the whole point of that is to just accept things. I think you can, in the experience, the what's elicited by the music under the influence of the ketamine is you can't really make sense. It's otherworldly and it seems very, very real. So people are not out of it. It's the antithesis of alcohol, the antithesis of marijuana or cannabis. It's really, you're almost more aware and more alert than you are right now without
Mm.
and you're watching these things come and go based on the songs. And in those things you see, you can't make sense of. Like you can, it's hard to make sense. Sometimes you have visions that make sense, but often it's just you're incredibly present in what is. And then the music changes, the whole thing dissolves, and you have to let go of it. And then the next song comes on, and some of the songs will elicit emotion. It triggers emotions, and some of the emotions are really wondrous and amazing and happy and joyful, and other ones are a little scary. It'll take us based on, on your previous experience. So, and you have to, even the scary ones will come and those will go. And then the next thing will be pleasant. And and it's like life, it'll take you on a sort of a journey of incredible presence.
Mm-hmm.
And during those, and then the thing, it lasts for 60 minutes, afterwards, about a half hour to come out of it. And then they meet with an integration coach again to make sense of anything that was maybe possibly scary and help reframe some of those scary. And often I found that some of the more difficult experiences are the most clinically beneficial, the ones where we really surrender the most, and where a lot of the work is done. And then there's just a piece, and we go through 6 of those sessions, and we find afterwards people are just more at peace. Things that would normally, what it does is it works at decoupling some of our past traumas, some of our memories from our emotions. If you want me to go into that, maybe I'm talking a little bit too much, but
No, not at all. No, that's interesting. I'm a psychologist, not an MD. I've never done any stuff with any sort of substance, but I was trained in EMDR, which is an interesting approach that often has that same effect. It'll decouple, basically, it'll make the memories safe to have again, so that the brain confuses the memory from the actual occurrence, as you well know, and that's one of the effects of EMDR. And it sounds like the psychedelic therapy, I'm sort of imagining, I will tell you, I'm relating to experiences I had 50 some years ago, way back in the day. I think it was 3 experiences with what I was told was mescaline. In those days, of course, God knows what I was actually taking. And the first experience was life-changingly wonderful. The second experience was sort of meh. The third changing experience was awful. I think it was like laced with speed or something, because at the end I couldn't stop. My mind was racing. It was really unpleasant. Never wanted to go near it again. And so, I'm imagining doing this as you're describing it. And the challenge for me would be precisely to not panic.
Right.
To not panic, and I think if I'm hearing you right, what you're saying is, yeah, some of the best, the most clinically significant and sort of useful result would be that ability to surrender that control, to just say, yeah, we're all, life is what it is, and what I describe as faith, that reality is right to be what it is, and developing that mindset. And this sounds like it's a really effective tool to help somebody develop that mindset.
Yeah, I think that's exactly what it's all about. And that's where the integration coaches come in, and the clinical support. So when you take these substances, whether ketamine or LSD, or they all have possible clinical benefits, but it's really about what we call the set and setting in psychedelics, is like the mindset, what you're going into it with, what you're asking for, and also the setting, having a supportive and a safe environment for you to do this. So when you do, if you do have and there's always going to be a scary part of it. But when you feel safe, you can go into that fear, go into those scary places. And then you have the people, our integration coaches, come in and reframing it, because that's what life is. Life is a bunch of scary, it's psychedelic also, life. And we're going to have difficult experiences. There's no doubt about that. But if we learn and we grow from those experiences rather than become a victim to them, there's a lot of wisdom and strength that can be gained from this. I heard it was a spiritual lecture, a Hasidic kind of Jewish lecture that came out, and they said that maybe it's from some other, I don't know where this is from, but it says that wisdom is a memory without the emotion, which I don't know, it just resonates with me. That, we have a certain event, a memory or some past event that, that if it's not properly processed, there's an emotion attached to it to get us to draw us there. Say, hey, there's some jewel in here. There's some kernel of wisdom and strength in here. Come get it, but sometimes we avoid, and if we avoid it, the emotions are just going to be stronger and stronger because we haven't processed it. But it's like an orange. The peel is bitter, but if you go in there and you go into the bitter peel, inside is this beautiful sweet juice. Just have to squeeze it out, put it in juice, and then get rid of the peel. But sometimes we're scared. We're too focused on nibbling away at the bitter peel, and we're not going into it. And I think that's what it gives us an opportunity, is to really go in, to let go of the messenger, or the bitterness, and to go in and process. And then once you process that, once you learn and grow from that difficult situation, then the motion's no longer necessary, and that just becomes a piece of wisdom. And the memories, the memory is intact, but it's not attached. The motion's no longer necessary to draw you to it.
Yeah.
And it is MDR, and we actually, a lot of people here, a lot of our members are paid, we call them members because we don't think of most people with mental health as sick necessarily, but they do EMDR with this. Actually, it works very well together.
Oh.
So we've been, and we're
Should
finding.
probably explain then for our viewers and listeners, EMDR stands for eye movement desensitization and reprocessing, was developed 30 some years ago. And it was fascinating when I used to do it. And of course, working with couples, I don't do it anymore. And I'm all telehealth now. So I actually know folks who do EMDR over telehealth. I don't. But I mean, there are folks who do. But it seems to be very effective at bypassing the panic response.
Right.
And you may know this, and as an MD, I'll bet you're more up to date on this. Has anybody actually figured out physiologically what the heck is going on that eye movements and other kinds of bilateral stimulation have that effect?
Yeah, I think it's interfering with I think the brain works in patterns, so we have like sections of our memories attached to emotions. And I call the brain is like a very sophisticated organic AI system, and it's here to make sure we stay safe. It's there so we exist in this world. That's its only job, really. And it does so by trying to predict, predict what's in front of us at this moment. Is this safe or not safe? And then to make adjustments, either to react if it's an emergent danger, to react to the situation, or respond to it in a way we so choose. But the problem is often when we have a traumatic event, that gets imprinted in our memory, and it gets attached through these it's called the default mode network, or these fibrous, these fibrous tracks that connect that memory to the emotion. So next time I see something that's similar to that traumatic event, it's going to trigger an emotion, get me to, move away from it or react to it in a way to protect myself. But most of the things we're reacting to are no longer dangerous to us. What happened to us at, a parent, unfortunately, a parent who abuses a child, at 5 years old, at 5 years old, we need our parents for our survival. We need them for our food and our security and all that. And when we're not getting that security and our survival seems at risk as a 5-year-old, that's a big problem. And that gets imprinted and we start to, protect ourselves. But at, 25 years old, at 30, at 60 years old, what happened to me at 5 years old is no longer, it's a program built in there, but it's not protecting me anymore. I'm safe. I can take care of myself. So those getting triggered, based on old memories, is like an operating system we haven't updated since we've been a child. So what it does is it with the ketamine and some of the psychedelics do, or EMDR, what it does is it opens up those fibers. It tries to decouple in a way, distracts through the, tapping or through the rapid eye movements. It distracts, you're eliciting the memory and you're distracting it from the emotion. So you're decoupling the memory from the emotion. And so that's part of the rewiring process, what we call a, neuroplastic process, which you can do with substances. The psychedelic substances work very well. It's faster, a little bit easier, but EMDR is a different way. Even spiritual practice, like Kabbalah, is another way of, it's a psychedelic experience. And it also is part of the rewiring process. So you can rewire through just learning and growing and seeing the world through different ways. A good book could rewire our brain too. So that neuroplastic process, but I think psychedelics really augment that process. And so next time you you have a little bit of a buffer, things that would normally trigger you into feeling safe. You don't go into it. You still have the memory, but you don't react. You have time. Okay, 1 minute. I have a little bit of time to respond to the situation. Like in a couple, your partner, triggers you. It triggers something it's bothering you. It's more of an issue with ourselves. When you work on yourself, you're no longer triggered. That thing is like, it's been processed. It's no longer bothering you. So your partner doesn't trigger you anymore. And you just deal with that. You instead of reacting and yelling at your partner, you're more peaceful. And it diffuses the situation. And then the partner's own traumas that are brought into it are also diffused, and then together hopefully creates a lot more peace in the relationship and less yellingness and more being with each other. And that's
relates to what I've talked about. You won't be surprised by this one. That we once had a podcast where I said, "Oh, I've come up with the phrase that solves all relationship problems, or the ability that solves all relationship problems." Like, not too grandiose, right? And what is it? Well, it's the ability to be mildly annoyed.
Right.
And it's
With
exactly
your
that.
partner.
It's with your partner in particular. Yeah. Because the one thing that I know of everybody is that we're all annoying. Well, except for you. But
Thank
I'm
you.
annoying. And I know I'm annoying. And you are very gracious about being mildly annoyed, which is to say, as opposed to triggered. That's exactly it. That when you transform things, as you said, you don't forget the memory. You
Right.
remember how bad it was if it was something really bad, but you're not in fight or flight or freeze mode because of that in this moment, because the
Right.
memory itself isn't dangerous. But of
Exactly.
course, the brain doesn't know that until you have the experience of actually going there without freaking out. And it
Yeah.
sounds like the psychedelics are very effective at helping people get into that space.
Yeah, I mean, I think that's exactly it. It gives us buffer. We are safe. And when someone's having a difficult experience here, sometimes they have a button, we'll come in, we check on them. They might be yelling. I never interfere unless they
Hmm.
ask me to stop. So if they ask me to stop, what I do is I'll come in, I'll lift up the eye mask, and I'll say, you're safe. You're
Hmm.
safe. And the unsafety, they are safe. I mean, I'm not lying. They are sitting in a chair doing nothing. The ketamine could not be safer. The doses in if you in our clinical setting. So they really are safe. So any unsafety is a perception.
Hmm.
It's really a perception, but and it's not real. So we tell them during it. I never say, "How are you? Are you okay?" No, we go, "You're safe. You're safe. You're doing great. You're safe." And it just calms them down and it teaches the brain to be resilient, to say, "Hey, I know I feel unsafe, but I am actually safe."
Hmm.
This person's triggering me. I hear someone yelling, and it reminds me of when my father used to yell at me. But I'm safe. This person's not going to hurt me in any way. I don't need them. I can walk away from it. Or your partner or whatever it is. Sometimes they remind you of something that happened to you when you were 5 years old. But you're safe. There's no reason to react, you know,
Hmm.
and it's just that's reality. That's truth.
Yeah.
Again, sometimes we react irrationally. We go in, we're living through these errant, algorithms in our brain. And that's what
Which,
Mhm.
yeah, which we do need, though. That's the other thing I'm often
Do.
noting. We
100%.
need the ability. We are the descendants of people who had to panic. In other words, we are not the descendants of people who didn't panic enough because they got eaten. So
Right.
we're the ones we panic too much rather than too little. Nature errs on the side of panicking too much. So we do need the capability, but when you recognize, oh, and of course the only way you learn that is not by avoiding the trigger, but by going through it. But
Exactly.
that is understandably scary.
It is
Yeah.
scary. And
Yeah.
life could be scary too. Most of the things we worry about, if you think about it, 99.9% of our life will be spent in peace. The few traumatic events or difficult events in our lives maybe sometimes lasted a few seconds, few minutes at most, and someone even a bit, and then we go in and then we go into safety mode, which is, what the brain is programmed to do, and that makes sense in certain situations, but I think we overdo it. And I think a lot of, especially with internet, with the over, with these systems now, they know the algorithms are our brain. They know what, and they give us a false sense of insecurity,
Yeah.
a false sense of fear, and fear sells products.
Mhm.
We use fear to elect our politicians. They use
Yep.
it very, very, very effectively. So it's also we're being misused. It's some of the survival benefits of the brain are being manipulated. So we're
Hmm.
not really, humans now, we're pretty safe overall. I mean, it might not seem that way, but we really are. Most of us on this planet, there's a lot that aren't, but most of us are.
Yeah.
And so I think we have to just tell the brain that, but it'll respond appropriately. By worrying about it all the time is not going to help us. It's actually affecting our health. So, worrying all the time does affect our cortisol levels, our immune system, our endocrine system, our neurologic system, our cardiovascular system are all affected by unnecessary, prolonged activation of these systems that are there to protect us, you know. So that's also part of the reason I got into it as an internist. It wasn't just to treat mental health, it's to treat our
Hmm.
physical health too. They do go hand in hand. And I've
Oh,
seen
sure.
over the years, I've seen many people, I think a lot of cancers could be avoided just by having a more balanced state of mind,
Mm.
more peaceful home, will help us in many, many ways that go beyond just our mental health. Yeah.
Mhm.
Are there long-term effects? I mean, back in the 60s, you'd hear that, people who would take LSD and then like a month later they would have a horrible trip and freak out. I mean, are there long-term effects with the ketamine?
Yeah, we haven't seen any, but I'll tell you there are a few contraindications. Some people like schizophrenia. So someone that has an underlying predisposition to like something like a psychosis, like schizophrenia, or bipolar, someone who has a potential to go into mania. Psychedelics can trigger, so they wouldn't cause it. So if someone doesn't have the predisposition, it's not going to make you psychotic. It's not going to make
Mhm.
you bipolar. But if you are prone to it, it can unleash, it can expose it.
Mhm.
So we've treated people with bipolar, and it can be a very effective tool to treat people who are in a very entrenched depressive state to get them
Mhm.
out. But
Yeah.
sometimes when you get them out, they'll get into a hypermanic or manic state. If they've had in the past, there are medications we use in advance to bring them back down or to use in advance to prevent them from going into those states. So it can
Mhm.
be really effective. We wouldn't give someone who says, oh, comes in, I have bipolar disease, I want to try this out. So someone who has bipolar disease or past history of psychosis who's been stable, you would never want to I wouldn't recommend doing psychedelics.
Mhm.
Anyone who has maybe even a family history and is in those two times in their life, like when two age groups where you start to see people develop, schizophrenia or the signs of schizophrenia, the effects of schizophrenia, you'd be very cautious if someone has a family history. I would avoid it possibly. In a
Mhm.
case like that. So those people who became psychotic from LSD or you heard about in the 60s were likely those people who weren't properly screened or might have had psychotic symptoms even before if you would have questioned them. And it obviously pushed them over into a more, florid state. And that's, not recommended.
Mhm. Yeah. So, I'm actually sort of curious, do you find, will insurance companies pay for the kind of treatment that you do at this point?
Yeah, so there's two ways. So we have the IV. So we have an IV, what's called racemic ketamine or generic ketamine. Generally, it's not covered in most insurance plans, but there are a number. So people have different good insurance. They'll if you can make a case to the insurance company, they will. We've had a number of people with really good insurance from some banks. Like we live in New York, so people are in finance. People work for Google or Meta. Some of these things that have very unusually good coverage. It is covered almost 100% in many of these people.
Mhm.
Other people, we could make a case if they've tried multiple treatments, you can try and call the company, your insurance company, and try and get it approved. So we'd give people the insurance, the coding, the different codes, and you can
Mhm.
try and get it pre-approved. Um, and it might not be fully approved, but parts of it can be approved. So
Mhm.
yeah, so that's something definitely people should try. We also offer what's called Spravato. It's a isomer, so it's like a part of the ketamine. So whenever you make a chemical compound, whenever you produce it, it's produced in two almost mirror images of each other. So every compound has that. Like there's a one that spins right, one that spins left, and sometimes only one of those isomers is the clinically effective. So what the insurance companies will do is they'll try and isolate out the one that works better. And they can actually apply for a patent. So something like ketamine, which the patents are over many, many years. It's generic. It's quite inexpensive. The substance itself, they can isolate. And so Johnson and Johnson or Janssen Pharmaceuticals, they isolated out the isomer. They applied for patents and they did all the studies and the millions of dollars. And then now it's available, and it's covered by insurance. So it's called
Ah.
Spravato. And it's a nasal spray. It's not a psychedelic. Oh, you can have a minor psychedelic experience, but it's not as yeah, it's not as experiential as you would as an IV treatment, but it does
Mhm.
work over it. But you need more of them, and it's more of an ongoing treatment. So they come in for a protocol of like two a week for 4 weeks, and then once a week for 4 weeks, and then it's an ongoing thing. It can be twice a month for ongoing. So that is an option for people who don't qualify, and that's only available. That's only approved for major depressive disorder or
Uh,
acute suicidality. So that's very
uh-huh.
specific. Yeah.
It's interesting. I have no idea if this is exactly what some I'm thinking, oh, at least 5 or 6 years ago, pre-COVID, I remember some clients I was working with, one in particular is coming to mind, who had had very little success with a very intractable depression for a long time and found going to somebody, I think it was actually an anesthesiologist that was offering ketamine at that point.
Yeah.
and found that it was really effective, more than anything else she had done.
I have to tell you, I think it changes almost everybody. We just actually were publishing a study on PTSD. It was just accepted in the Journal of Psychopharmacology.
Mm.
And our response rates to treatment resistance. So these are people, most of the people who come in here have been through years of treatment. And we found that we had about a 74% response rate to the ketamine, to the IV ketamine for PTSD. So their scores came down significantly. And then we had a complete remission in about 63% of
Wow.
our patients, which is pretty
That's
crazy,
good.
which is
And for treatment resistant in
resistant.
particular, that's amazing. Yeah.
Yeah, these people, I think the average person was on, I think, 4 or 5 different medications in the past, years of psychotherapy, and they just feel stuck.
Mm-hmm.
Mhm.
It's just a matter of, just in the end, we have to let go. It's all about, I think if psychedelics, if I have to sum it up, it's all about really going into a process of like really letting go,
Mm.
accepting and letting go. And it's tough. It's hard to do.
Yeah. So how can people get in touch with your program?
Yeah, so they could look us up. We have Nushama, NUSHAMA.com. So we have a website. So you can reach us through there. That's the best place to go and see what we're about, what we treat. We also treat addiction, eating disorders, and PTSD, of course. Yeah, but addiction also, we found incredible response with addiction, alcohol addiction, cannabis addiction, even sex addiction. We have issues with that, and we see that a lot in couples.
Mhm.
Overuse of pornography can be, could eventually have a negative impact on relationships. We see a lot of people coming in with that. So, yeah, so those are our main indications. So you can find us on or our centers in, I don't know where you live.
We're in
We're in
Vermont,
Vermont.
but
Oh,
people
great.
hear us all over the world. So,
I'm from Montreal, so I love Vermont.
uh-huh.
I grew up going there.
Neighbor.
Yeah. Yeah, we're located in Midtown Manhattan on 53rd and Madison. We have a beautiful center.
Mhm.
I think beautiful and great work. So it's a beautiful treatment. It changes people in a very good way. It doesn't change who you are, it just makes you more who you're meant to be, I think. So
Mm.
yeah.
Well, thank you so much for doing this. We'll make sure to put that link in our episode notes, and Gemar Chatima Tova. For our listeners who know what that means, they can look it up.
Yeah,
And thank you so much.
thank you. Thank
Thank
you for
you.
having me.
Our pleasure. Welcome back. We hope you enjoyed that interview with Dr. Radowitz and learned something.
And I think, we certainly learned something
We learned a
by talking
lot.
with them.
Yeah.
As we do with so many of our guests, which leads me to suggest if you'd like to suggest a guest for us to interview or a topic for us to discuss, because some of our most popular episodes are ones where we did not have a guest. We just discussed some particular topic of interest.
Right.
And some of those are like super popular.
Yeah.
I just noticed we had thousands of downloads of the particular one we did about, I think the title was "My Wife Found Out I Cross-Dress, Help."
Oh, yeah.
And
that's
that one
a good
we have had thousands upon thousands of people that have downloaded, which is kind of interesting. It's not our specialty, but we were talking about an interesting topic, obviously a topic of concern to a lot of people, and we've gotten quite a response on that. So anyway, if you want to suggest any of that, go to ctn7.com. You can send us a message. You can even sign up for a time to be interviewed yourself on our podcast. In the course of doing that, we'll ask you, gee, why do you think you'd like to be a guest? What do you have to talk about?
Right.
And you know what? If you think you are a good guest, I'll bet you are.
Yeah, we've gotten quite a few guests that way.
Absolutely.
So you might be one of them.
And buy our books and tell people about our podcast.
And follow us and subscribe or like, whatever.
All that stuff.
And share us on social media.
And so until next time,
Remember, be kind
don't panic.
and have faith.